If you're currently suffering from sciatica, it's likely that you've looked online and seen loads of information which is just doom and gloom about this condition. Well, if that sounds like you, then today's video will hopefully make you feel a bit better. Hi everybody, my name is Will Harlow and I'm the Over-Fifties and Sciatica Specialist Physio here at HT Physio in Farnham. And today I'm going to be giving you 7 reassuring facts about sciatica, which will hopefully put you in a more positive frame of mind about the condition. Now, before we dive into the content of the video, if you haven't already, please like this video and subscribe to the channel using the link in the bottom right, because then you'll be the first to hear about our new sciatica videos as soon as they come out. Now that that's been said, let's talk about sciatica, the fact that it is a condition that causes pain in the leg, nerve pain. It often goes down the back or the front of the leg. It's usually a condition that involves the lower back as well, so most people have back pain, but not all. And the fact of the matter is it can be a very debilitating condition. Obviously, when you've got such pain, like in sciatica, the most common thing for people to do is to go online, read all about it. And I'm afraid to say that online there's a lot of misinformation about sciatica. Now, a lot of the healing timescales that I read about online are just plain wrong. Maybe you have found a forum of people with sciatica and it just seems like all there is despair around this condition. Maybe you've read that you're going to likely need surgery and you're worried about the prospects of that. Well, if that's you, today I'm going to bust some of those myths and hopefully give you some of the true facts about sciatica. So let's talk about 7 facts that not many people know about, which will hopefully make you feel a bit more positive about what you're going through right now. Before I say this, I just want to say I'm not minimizing the suffering that people with sciatica have. I appreciate it's an incredibly painful condition for many people, but I just want to give you some facts which will hopefully give you some light, some hope at the end of the tunnel, because the truth is most people do get better. And that's fact number 1, is that 95% of people who have sciatica will eventually get relief from the condition. Now, sciatica can be caused by lots of different things, and depending on the cause of the sciatica, that will dictate the recovery period and what goes into the recovery. But the fact of the matter is, sciatica is usually not a permanent condition. Problems like disc bulges in the spine, so these disc injuries that affect the bottom of the spine and cause a pinching on the nerve root, they tend to get better. They tend to take up to a year to fully heal, but regardless of how long it takes, they do usually get better. Herniated discs, even if the disc herniation itself doesn't heal, the sciatica does tend to go away for most people. Even if your condition is caused by arthritis or wearing away of the spine, while the problem itself doesn't go away, the sciatica can go away. So all in all, 95% of people with sciatica can expect to eventually make a full recovery, providing they do the right things. And one of the biggest reasons I see people who've had sciatica for 2, 3, 4, 5 years and not got better is because they haven't been given the right information to help them heal. If you're not doing the right exercises, if you're just making it worse, if you're doing the wrong things, if you're forcing through the pain, if you're not getting healthy and eating the right foods and drinking enough water, all of these things can go into a recovery. And if you're not doing them, the problem might not get better as quickly as it should. So 95% of people who do the right things do get better. If you're not better yet, the easiest thing to assume is you're probably not doing the right things. So go and get some professional advice, because that usually can help to kick things into action. Now, the second reassuring fact about sciatica is that sciatica caused by disc problems can get better before the actual disc injury heals. Now, this is a very confusing fact, and it's one that took me a while to understand. But when you have sciatica, the most common cause of sciatica is a problem with the intervertebral discs that live in between the vertebra in the spine. And a disc bulge, which is when the inner material of the disc starts to push towards the back, that can pinch a nerve and cause sciatica. And a disc herniation, which is when the inner material leaves the disc, that can also press on the nerve and cause sciatica too. Now, disc problems are very slow healing. They take a long time to heal. But confusingly, the symptoms that someone gets doesn't always match up with what the disc bulge or the herniation looks like. So sometimes we can have people who have quite a severe disc injury, but their sciatica symptoms get better quite quickly. Now, I've had patients where they've had one MRI scan when they've had sciatica, and the disc is bulging pretty nastily, it's touching the nerve root, and they've got symptoms. Then we do a 6-week course of therapy. The symptoms get loads better. They almost get to zero. They don't have any sciatica left. They have another MRI scan, either because they booked it early doors or because their doctor sent them for another one just to check. And the disc bulge looks the same, but their symptoms are totally different. Now, that's happened lots of times to patients that I've had in the clinic. And the answer to why that happens is I really don't know. It's just one of those mysteries. It happens a lot in other areas of medicine. We can have the pain can go away even though the problem remains. That's why we tend to treat the person, not the scan. So we look at the person's symptoms, how well they're moving, how much pain they're in, rather than just treating them based on a scan. So if you're worried about your disc bulge, if you have multiple scans and they all look the same, try to focus more on how it feels. If you're having a good day, try not to obsess over the fact that the injury might still be there, because what's happening on the pictures doesn't always match up to what's happening with the patient. Now, the third reassuring fact about sciatica is that for most people, 99% of people, movement and exercise helps the problem. Now, you might think, well, when I'm moving, when I'm exercising, that's when the pain is worse. And I can understand that's a very frustrating place to be. However, what that often means is you're not doing quite the right exercises or the right movements to help, because there will usually be some form of exercise or some movement that you can find that helps the problem. Now, when we move, when we exercise, what we're doing is we're bringing nice, healthy blood flow to the areas around the spine. We're encouraging the body to heal. We're telling the body that, look, we still need these structures. We still need a healthy disc. We still need healthy vertebra. We still need those joints in our spine to loosen up and move well. And when we're communicating that to the body basically says, okay, well, fine, I'm going to have to start fixing it. If you were just lying in bed for 6 weeks, there's no signal going to that area in the spine that needs to heal. So the body goes, well, we don't need this structure anymore. Why would we send blood flow there to heal it? Okay, that's how I think of movement and exercise as opposed to rest. So rest usually makes these problems worse. Exercise usually helps the problems to get better. But the important thing is that the right exercise is done. This is definitely not an instruction to go out and do exercise that hurts your sciatica or makes it worse or aggravates it, because that's counterproductive. It's very important that you find a type of exercise to do that feels good. It might be walking, it might be swimming, it might be cycling. It's different for everyone. Plus an exercise routine that you can go through, either some stretches or some strengthening or some mobility movements that don't hurt the problem, that feel nice to do. And over time, that is what will help your sciatica to get better. Now, the fourth reassuring fact about sciatica is that only 1 to 3% of people with sciatica eventually need surgery. So it's a very, very small number of people who end up having to go underneath the knife in order to get the problem better. Now, I'll caveat that by saying if you have severe weakness or severe numbness, or you have any of the symptoms that make up a condition called Cauda equina syndrome, then surgery might be needed. But if it's pain in the leg that varies with time and is just about manageable, it's very unlikely that eventually you're going to need surgery. You just need to give it more time, do the right things, take the advice from the practitioners that you see, and hopefully it will get better with conservative means. I've had loads of people who've come into the clinic with raging sciatica. They've had symptoms so bad they can barely stand up, they can hardly move. But give them the right advice, and even for these people, the vast majority of them do get better without having to have injections or surgery. Now, in instances like this, when the pain's very bad, painkillers obviously can help, so get advice from your GP. But usually, if you follow the right advice, you do all the right things, and you give it time, you are patient about it, and you don't let it distress you any more than it absolutely needs to, usually that's a recipe for helping it get better as quickly as possible without surgery. Now, the fifth reassuring fact about sciatica is that Cauda equina syndrome is incredibly rare. Now, Cauda equina syndrome is basically a severe form of sciatica that's usually caused by a disc problem where the disc or something else in the spine is pushing on the bottom of the spinal cord, and it's affecting the nerves that supply your bladder, your bowel, and your perineum, which is the area that you sit on, okay, and your genital region. Now, if that happens, then it is a medical emergency, and for those cases, surgery is usually needed. So, not to give you an exhaustive list of symptoms, but problems with bladder and bowel and numbness in the private parts are two of the key signs of Cauda equina syndrome. And if you look up sciatica online, you'll see lots of information about Cauda equina syndrome, and quite rightly, because if you get it, then it's an emergency. However, let me just reassure you that Cauda equina syndrome is very rare. It only affects between 1 and 3 people per 100,000 people in the population, and many, many more people than that get sciatica. So the vast majority of people who have sciatica will not ever develop Cauda equina syndrome. It's still important to look out for those symptoms, but if you're very, very worried that you're going to develop it, try to relax a little bit unless you have those symptoms that you can read about online, because for the vast majority of people, it's just not going to happen. So if you're in any doubt, go and get checked out by a practitioner, someone who knows what they're talking about, like your doctor or a local physio who can have a look at it and say, well, yeah, I think you need to get checked out further or not. But for most people, it's not going to happen, so try not to worry quite so much. Now, the sixth reassuring fact about sciatica is that even if arthritis is the cause of your sciatica, the symptoms can still improve. Now, I get people who come in and they're in their 70s and their 80s and they've got sciatica, and I say, look, you've got arthritis in your spine most likely, or they've had a scan and it shows that. And when they hear that, they think, this means now that that's it. It's going to be like that forever. And the fact of the matter is, that's just not the case for everyone. For many people, even if arthritis is the cause, we can still reduce the sensitivity of the nerve, we can free up that nerve entrapment, we can reduce tightness in muscles, we can get the spine moving better, and almost miraculously, the sciatica can go away. So if arthritis is the cause of your sciatica, that doesn't mean it's a life sentence. Now, for some people, if the arthritis is particularly bad and the nerve is well and truly trapped, then yes, it can be more of a permanent problem. But these people are more rare than you might first think. For many people with arthritis in the spine, usually the entrapment of the nerve is not too bad. It's just a bit of an irritation. And there are movements and actions and exercises that can be done to reduce that irritation and take away the symptoms as a result. So even if you've got an arthritic spine and you're getting sciatica as a result, it's still worth looking for treatment because it's something we can often help people with and reduce their symptoms significantly. And then the seventh and final reassuring fact I have for you about sciatica is that sciatica does not need to become recurrent. So many people who have sciatica, they will look online and all of the online stuff will say, once you've had it once, that's it, you're going to get it over and over and over again. And I'm here to tell you, if you do the right things, that's just not the case. A lot of the treatment I do in the clinic here is not just to fix a problem, it's to prevent it from coming back. That's why I offer plans of treatment here that help people to maintain the improvement they've got. Now, of course, not everyone needs to have maintenance treatment. Some people are able to just go away with their exercises, keep working on them, and keep things at bay. And for the vast majority of people, no matter what caused the sciatica in the first place, once it's been fixed, if you keep doing the right things, it's not likely to come back. Of course, some people do get recurrent sciatica, and I feel very sorry for those people, but more often than not, with the cases of those people I've seen, there's something they're doing wrong that seems to be triggering it over and over again. So if that's the case for you, it's important not to just accept it for what it is, but go and get an opinion for why it might be happening. There's almost always a reason for why something keeps coming back. And for most people, they just haven't got to the bottom of it. They haven't quite got to a point where they've worked out what's causing it so they can avoid it or change it and stop it from happening in the future. So for the vast majority of people I see who have sciatica, even if it's caused by a severe disc herniation, if the problem is remedied, fixed properly, it's rehabilitated properly, flexibility is built back up, mobility is built back up, strength is improved again, there's no reason why it needs to come back again and again. So I hope that's made sense. Those are the 7 reassuring facts about sciatica. I'm just going to give you a recap now. So the first is that 95% of cases of sciatica do get better. The second fact is that the recovery from sciatica does not always line up with the healing of a disc. The third fact is that movement and exercise usually helps the problem. The fourth fact is that surgery is only very rarely needed. The fifth fact is that Cauda equina syndrome only happens to 1 in 100,000 people and is very, very rare. The sixth fact is that arthritis does not need to be a life sentence of sciatica. And the seventh fact is that sciatica does not have to become recurrent. Anyway, that's all from me. I hope that's been a useful and interesting video. If it has, then leave me a comment below. And if you want to get more from me, please do pick up a copy of my book. It's called Thriving Beyond 50, and you can find it on Amazon using the link below this video. Anyway, that's everything from me today. Thank you so much for watching. I look forward to speaking to you on the next one.